Hi, I'm Dr. Sarah Hensley. I'm a specialized social psychologist who's been studying the science of attachment and attraction inside romantic relationships for over 15 years. In this video, I want to take a deeper look at the fearful avoidant. So many people who study attachment have really stuck with outdated science that groups people into just anxious categories or avoidant categories. We actually have an attachment style that can be both anxious and avoidant, and that attachment is referred to as fearful avoidance. So, fearful avoidance is an attachment style that usually develops when there's some kind of childhood trauma. So, it doesn't have to be a big trauma, it can be minor trauma, like my parents, fought a lot and I heard them fighting. It could be a more serious trauma, like a divorce that was handled really poorly between the parents. It could even be as serious as a parent that had an alcoholic abuse problem, a drug problem, or a mental illness. Sometimes those with fearful avoidant attachment even experienced abuse in the home. When these kinds of traumas happen, there is a point in time where the small child stops trusting one or more of their caregivers. And this is a really unfortunate situation because the way that that's imprinted into the subconscious is if I can't trust my own caregivers, who in the world could I possibly trust? Which is why the fearful avoidant deeply struggles with the wound of betrayal. They have other peripheral wounds, but this one is definitely in the driver's seat for the fearful avoidant. And that betrayal wound really makes them extremely hypervigilant. So, one of the key hallmark characteristics of fearful avoidance is this hypervigilance. Essentially, it's putting people under a microscope. Fearful avoidance can notice a tone change, a behavior change, a pattern shift instantly, and they can give it a lot of meaning. And sometimes that can be a really painful meaning. And the reason that hypervigilance developed is because if you had an unstable caregiver to a degree, when you were around that caregiver, you really had to study them in order to stay safe. It was like, is mom drinking today? Or is she going to be nice to me today? Should I hide up in my room today? Can I approach dad with this conversation today? What kind of mood is he in? And so fearful avoidants get really, really good at studying other people. And unfortunately, they can sometimes have a very negative bias when viewing other people's behavior, meaning they're more likely to see the negative in people's behavior than the positive. A few other very key characteristics of fearful avoidance. Besides hypervigilance, we know that they can swing into both attachment anxiety as well as attachment avoidance. It really does depend on what's going on, whether they will be anxious or they will be more like the dismissive avoidant. Usually, fearful avoidants act in opposition to their partners. So if we have a fearful avoidant who is with a dismissive avoidant, they will lean heavily to their anxious side. If you have a fearful avoidant who's with an anxious preoccupied, you will see them lean a lot more dismissive avoidant in their behavior. See, they have some mix of both of those types of wounding plus the betrayal wound that's really in the driver's seat. Fearful avoidants have a lot of variability in their behavior, meaning that they're a little harder to identify in terms of the consistency of their behavior compared to the other attachment styles. A dismissive avoidant, they usually all act very, very similarly. Sometimes I even joke, it's like they go to dismissive avoidant university and get a diploma in dismissive avoidance. I can't say the same thing for my fearful avoidants. They have much more variability in their behavior. That's because some of them are going to have more anxious wounds and lean more anxious, and some of them are going to have more avoidant wounds and lean more avoidant. Now, that doesn't mean that they don't have the entire spectrum to which they can swing back and forth. But overall, I don't see a lot of fearful avoidants that kind of look exactly the same. There are a number of notable characteristics that are more common among all of the fearful avoidants. One is of course, hypervigilance. Two, I would say, is the moving goalpost. Fearful avoidants tend to do subconscious trust tests of their partner. So maybe one day they're angry because you didn't clean out the garage. And so you step up as their partner and you start cleaning the garage and keeping it clean. Well, then the next day they're upset because you didn't give them a hug when you walked into the door. And so you take note of that and you try to give them a hug when you walk in the door. It really keeps on happening where they just change the goalpost of a way that they need you to essentially meet their needs, which in terms of meeting their needs, they really, really want you to study them and to notice them as a unique individual and really sort of almost mind read and predict their needs and swoop in there and meet them without having to ask. For the fearful avoidant, having to ask for a need often means that it doesn't count or that you don't mean it if you complete the need. So, fearful avoidance can often sort of always have a problem, and that's really difficult when it comes to managing a healthy relationship. Fearful avoidants tend to be the deepest feelers. They have the most trauma and the most wounds. And so the deep feeling often results in their trauma responding. They really often struggle with the ability to self-regulate the depth of their emotion and the stimulation of their nervous systems. So fearful avoidance can sometimes be more reactive during conflict, much more so than the other insecure attachments. Fearful avoidants also really, really deeply need to be seen, heard, and understood. And this has to do with their large betrayal wound or wound around trust. So just like we don't trust somebody that we meet off the street when we don't know anything about them, fearful avoidants need to be able to know you deeply in order to trust you. And on the same token, they want you to know them deeply, and that makes them feel like they can also trust you. It's like, if you know me deeply, if you see me, if you understand me, then you won't hurt me because you'll know what hurts me. Again, their biggest fear is around being hurt inside of a relationship. So they will often really come close and they will want connection and they will seek it out, only to back away from it and get really afraid when they feel like they may be hurt, when somebody has unintentionally crossed their boundaries or has made them feel unsafe in some way. So, fearful avoidance will often oscillate between really seeking connection and then pushing it away hard. Unlike the dismissive avoidant, where they sort of do that slow creep away over time, the fearful avoidant will do a hard pushback. So they'll block, they'll slam the door in your face, they'll kick you out, they'll break up with you. They have these very harsh pushbacks. And that can be really, really confusing when it feels like a simple fight then turned into a breakup. So fearful avoidants really need to, just like the other attachments, learn to take control of their thoughts and regulate their nervous systems effectively. But they really have to deal with their betrayal trauma. They have to be able to regulate themselves and understand that they will be okay and really find safety in their own nervous systems with this idea that love may not work out. And unfortunately, fearful avoidants, because of their trauma, are attracted to people who will further traumatize them. They are the most at risk of being attracted to narcissists or severe dismissive avoidance or people with addictions, etc. So I am a former fearful avoidant and I know what it's like to live in that skin. And if I can step into attachment security and remain secure, then I feel like anybody can do it. Please like, please subscribe. I'm going to do deeper dives into attachment as we move along.